It's our hope that by watching this brief video, it will help you to maximize your results with your clients. All of the evidence shows that the toughest part of the LipoMelt process is not the release of the fat cell contents, but instead getting it into the lymphatic system and to the liver. If your clients follow the proper protocol, their lymphatic system will be stimulated and their interstitial region will be flushed of the excess fatty acids. Once the interstitial area has been vacated of the majority of the fatty acids, the treated area of their body will become reduced in circumference. Now remember, these next few steps can mean the difference between success or failure. LipoMelt first. Nothing should be done prior to the LipoMelt process. Otherwise, the light's impact will be reduced. Some of the things that can interfere with the light's penetration include heat, any type of therapy, acupuncture, massage, and any kind of exercise, which includes the vibrational plate. In other words, anything that could stimulate blood flow and swell the area. Hydration. It's important that the client be well hydrated throughout the day. In fact, this has proven to be more important than originally thought. And for this reason, it would be wise to also provide your client with water at each session. No eating before or after each session. Make sure to remind your clients to not eat anything within 1 hour before or after each LipoMelt treatment. This will allow the body to concentrate on the extra fat being released. Scheduling. Remember to schedule each session with a day between so that the body can have a chance to process the extra fat. 2 to 3 times per week is ideal. Exercise. It is recommended that you offer some type of exercise in your business immediately following each session. Don't rely on the client to do it on their own. 10 to 20 minutes on a whole body vibrational device in your office is the most efficient and effective method. Alcohol. Make sure your clients reduce or eliminate consumption of alcohol while receiving these treatments so that the liver can concentrate on the increase in fat released by the LipoMelt therapy. Diet. It's recommended that the client try to lower their overall caloric intake by reducing starchy carbohydrates, simple sugars, and sodas. But remember, change in diet is not necessary for success with the LipoMelt. Liver supplement. Have your clients take a supplement that assists the liver in terms of health and capacity to process an increased amount of waste. This will lead to a greater portion of the fatty acids being eliminated. Snug Clothing. Every individual is unique in terms of how their body will react, and some individuals will apply more effort than others. For this reason, how you document their transformation is critical. Before and after photos, measurements of the areas to be treated, and weighing each patient are steps you need to take. But some clients will have less visibly noticeable results than others, where they lose an inch here and then maybe an inch there. Additionally, since their transformation is gradual and won't happen overnight, they might not notice a significant change when they look in the mirror. A very simple step is to have your clients come to their first appointment with clothing that they can no longer comfortably wear or look good in. Take a few good photos of them wearing these clothing items, being certain to show how tight or ill-fitting their appearance is in them, with the knowledge that you will take the same angled photos of them in the same clothing at their 10th appointment. This will provide obvious visual proof to your clients of the efficacy of their treatments. First session suggestion: only treat one region for maximum results. If your goal is to prove to your new client that this therapy works, you should only apply the pads to a single area, allowing the body to concentrate on removing the fat from just that one region. Sell packages. It's recommended that you always sell a package in a series of minimum of 10 sessions. You're better off not starting with a client who won't come in the number of sessions you need for good result. Your best candidates. Your best candidates are those who are just overweight and are not otherwise ill. Now, that doesn't mean you can't help these sick clients as well, but they will have a slower response. A patient who has the following issues will usually respond slower: liver, kidney, or thyroid disorder, alcohol or drug addiction, hormonal issues, and IVF patients. Expectations. If your client has unreasonable expectations, you'll be doomed to failure. The average patient should expect 1 pound and 1 inch off per session. But obviously there are exceptions to this rule. In fact, we just discussed some of the people that will have slower response to this therapy. But it's really important that you discuss what the client should expect. Don't worry, you'll become better at this with experience. Please remember to not throw any packaging materials away. You'll need these containers in the event you have to send your unit back to the factory. Please know that your success is our main goal, so don't hesitate to call if there's anything we can do for you.